Thank you for the introduction. I'm going to be presenting results of the ACCURATE-DDI study. I have no conflicts. OpenAI's ChatGPT has transformed our ability to rapidly access all sorts of information, but how does it do with pharmacologic questions? Early research on older models of ChatGPT suggests it doesn't do so well. A team of American researchers found that ChatGPT, when given drug information questions, answered nearly 75% of them incorrectly or incompletely, and it went on to make up fake references to support its claims. In another study, when ChatGPT was compared to conventional drug-drug interaction tools such as micromedics, ChatGPT had less than a 50% accuracy in predicting drug-drug interactions, or DDIs. So we sought to evaluate the performance of ChatGPT in identifying drug-drug interactions with antiretrovirals. We utilized a cross-sectional observational study design whereby we compared the free version of ChatGPT, which was 4 Omni Mini at the time of data collection, to two well-known and established reference tools, the Canadian HIV and HCV Drug Therapy Guide and the University of Liverpool HIV Interaction Checker. We included ARV drug-drug interaction pairs across a broad range of medication classes and drug interaction mechanisms, including pharmacokinetic and pharmacodynamic. We excluded drug interaction or DDI pairs whereby there was conflicting where there's some sort of discordance between the two reference tools, or if a drug was missing from either of the reference tools. And we generated ChatGPT responses in November 2024, and the data were reviewed using REDCap. This is our study flowchart. Part 1 was quantitative, and we asked ChatGPT a multiple choice question. Is there a drug interaction between drug A and drug B? A, no interaction, B, potential interaction, or C, serious interaction. We found that ChatGPT didn't just say A, B, or C. It went on to provide a very verbose answer, which, even if they got the multiple choice question right, the rationale was not always correct. So we thought that needed to be delved into a little bit further, hence part 2, our qualitative component of the study, whereby we analyzed the free-form responses from ChatGPT. So here's the ACCURATE-DDI classification tool, which was used for part 1 of the study. On the far left, in the far left column, you have the 3 columns used for classification in our study. Green is no interaction, DDI pairs, potential in yellow, and serious in red. In this box here, you have the drug interaction classification categories from our reference tools. In this box here, we've got the correct responses from drug interaction questions from ChatGPT, or responses from ChatGPT, and they're broken down into true negatives and true positives. So true negative is when ChatGPT is given a non-interacting DDI pair as a question, and it correctly identifies that there is no drug interaction. Conversely, a true positive, it identifies either a potential or a serious interaction when a potential or serious interaction exists. And then here is the incorrect responses from ChatGPT, false positives in beige and false negatives in light blue. So in terms of data analysis, we had 2 pharmacy students categorize the multiple choice responses for part 1 using the ACCURATE-DDI classification tool shown. And we went on to calculate performance metrics such as accuracy, sensitivity and specificity, and positive and negative predictive value using the formula shown on the slide. In part 2, we had 2 HIV pharmacists or pharmacologist reviewers independently scoring ChatGPT's output across 4 domains using a rubric. The 4 domains that we assessed were severity, mechanism of the interaction, clinical effects, and management, all of which are established components of drug interaction completeness assessments. And reviewers scored either a 0, 1, or 2 for each domain, 0 for incorrect information, 2 for correct information, and a 1 if the information was a bit mixed of correct and incorrect information. There are 4 domains, max of 2 scores, 2 points in each domain. So the max composite score for each DDI pair was 8. And whenever there was a discrepancy in score of 2 or more between 2 reviewers, we would call in a third reviewer to resolve via consensus. So our results. ChatGPT's accuracy was just 40.4%, and errors were primarily driven by false negatives. On the far right of the screen over here, we've got the results stratified by drug-drug interaction severity. So among the no interaction pairs, you'll see there is a pretty high proportion of false positives. The potential interactions, ChatGPT did quite well, whereas for the serious interactions, there was a 100% rate of false negatives. In part 2, across 25 pairs, the mean composite score was 3.9 out of 8, suggesting that the majority of responses had a pretty even mix of correct and incorrect information. Stratified by DDI severity, the no interaction pairs scored just 2.7 out of 8, suggesting there was more incorrect information than correct, whereas the potential and serious interaction pairs had scores of 4.2 and 4.3, so a pretty even mix of correct and incorrect information. To delve a little bit deeper into the qualitative data, for the no interaction pairs, you see severity with a score of 1 out of 2, bit of a mixed bag. Sometimes it was correct, other times it incorrectly warned about drug-drug interactions that didn't exist. Interestingly, the mechanism was often incorrect, especially when we tested drug interactions involving cobicistat and a co-medication that was not a major CYP3A4 substrate. So a prime example of this is bupropion and darunavir cobicistat, which we call Prescobix in Canada. So there's no clinically significant drug interaction expected here, yet ChatGPT says there potentially is one. It warns that cobicistat will increase bupropion exposure via CYP3A4 inhibition, potentially leading to seizure risk. Now, bupropion and seizure risk is an established association when bupropion doses are too high. However, as a result of this drug interaction, we would not expect an increased risk in seizures because there's no clinically significant drug interaction, and so therefore this information was incorrect. For potential interaction pairs, once again, we see that the severity was often correct. However, the mechanism and clinical effects often incorrect. Where it often performed poorly was when we tested ritonavir DDIs with co-medications whereby the interaction was mediated by a non-CYP3A4 mechanism. And it also missed pharmacodynamic DDIs. A prime example being methadone and fostemsavir. Here, there's a potential interaction resulting in additive QT prolongation. ChatGPT correctly identifies that there's a potential interaction, but it attributes it to a pharmacokinetic mechanism, incorrectly saying that fostemsavir will increase methadone exposure via CYP3A4 inhibition, leading to potential methadone overdose. Among serious interaction pairs, severity did quite poorly with a score of 0.4 out of 2 because the risk and the language was often understated for contraindicated drug interaction pairs. That said, the mechanism and clinical effects were often correct. Management, though, was often incorrect because it would have a tendency to say to go ahead and proceed with co-administration when avoidance of the of the 2 medications was necessary. An example here being enzalutamide and doravirine. So this is a contraindicated drug interaction because enzalutamide is a strong CYP3A4 inducer, doravirine is a CYP3A4 substrate. We'd expect a risk of reduced doravirine concentrations, putting the patient at risk of virologic failure and drug resistance. But ChatGPT says there's no major known interactions and all but gives the green light to proceed with these medications. So limitations of our study, the mixed and vague responses made scoring challenging and increased the variability between scores. That said, only 3 of our 25 DDI pairs in part 2 required consultation of a third reviewer. Results may not be generalizable to all users. Certainly we saw this in the pilot when responses, or in our pilot testing, when responses certainly varied depending on the wording of the prompt inputted. However, we did note that even when the specific wording varied, overall accuracy was similar. And just like HIV therapeutics, AI is a rapidly evolving field, and it since has already evolved since this data was collected, with a new update in August. So in conclusion, ChatGPT demonstrated limited accuracy and specificity in assessing ARV DDIs, often generating responses that included a mix of correct and incorrect info. There was a high rate of false negative classifications observed, with frequent underreporting of serious or contraindicated DDI pairs. And ChatGPT is not yet a reliable tool for ARV DDI information, so the HIV pharmacists in the group can rest assured we may have a little bit of job security.